My name is Dr. Chike Amagi. I'm a GP in North London.
My name is Dami Adedaya. I'm a GP in North Central London.
I am Dr. Tal and I'm a GP practicing in England.
My name is Tori Raomotomilola. I'm a general practitioner based in Hertfordshire.
My name is Dr. Atobatale. I am a GP in Hertfordshire. I'm also a member of the AfroGP Herts Beds group.
We thought we'd make this video hopefully to help people think more positively about getting the COVID-19 vaccine.
From our COVID experience, we know that black people are 4 times likely to die from COVID than white people. But in a recent survey, it was shown that 72% of black people were unlikely or very unlikely to take up the jab. Now, these are brutal statistics. And clearly vaccine hesitancy is now a big problem in our community. It's not really been helped by the widely shared false rumours, false science regarding the vaccine itself.
We are aware that people have different concerns about the reliability of the vaccine and of the motives of the government in giving the vaccine to the population, especially the African population.
I know some of you have concerns about the COVID-19 vaccine affecting your fertility. I can assure you that this does not happen. Some people have also raised concerns about it affecting the placenta and therefore pregnancy. Again, there is no clinical evidence that this happens.
And one of those rumours is that the vaccine itself will affect your DNA. Well, the good news is that this is simply untrue. This is not based on any scientific principle at all. The most reassuring thing about this vaccine is that it does not enter the nucleus of your cell. Now, the nucleus of your cell is where your DNA is contained. So there is no way that the vaccine itself will be able to alter your DNA.
The myth about there being a tracking device. It is virtually impossible to pop a tracking device or a microchip of any kind into 0.3 to 0.5 mils of liquid, which is what is contained in the AstraZeneca and the Pfizer vaccines. We do know that the vaccinations are made up of genetic material which offer our body the opportunity to create antibodies against the spike protein so that when we encounter the virus in the future, we're protected. Now, as soon as the materials entered into the body it disintegrates completely. If you have a mobile phone, if you have a laptop, if you have a tablet, that's more than likely to have a tracking device in it. But these vaccinations don't have tracking devices in it.
There's so many conspiracy theories flying around. I just wanted to debunk a particular one that says that black and ethnic minority group people are given a different vaccine from the rest of the population. This is so untrue. From one vial of vaccine, you can get several doses, and there's no selection as to who gets what and who gets which doses of which vaccine. So this is completely untrue. What I would say to anyone who is still contemplating taking the vaccine or who is still doubting, please do your research.
I have had the vaccine. I had the first dose of the vaccine on the 6th of January, and it didn't even affect me as much as flu jabs have in the past. Sometimes after I've had a flu vaccine, I might feel a bit poorly for a few days before I get back to myself. The only thing I remember from having the COVID vaccine in January was my arm ached a little bit for less than 24 hours, and that was it. I was back to normal.
All my GP colleagues have had the first dose of the vaccine. I myself have had it, and both my parents have had it. I am asking and imploring you to ask your friends and family to take up the vaccine.
Protect yourself, protect your families, and for those of us who are clinicians, we also need to protect our patients by being vaccinated. Thank you.
It's important to stay safe. Take care.
I'm sure you've enjoyed watching the video made by GPs from AfroGP Herts Beds group. Please email questions to us at covid19 at afrogp.co.uk. You can also find us on YouTube at AfroGP Herts Beds. Thank you for watching. Please share with your friends and family.